with the refrigeration. We're going to talk about, whoops, sorry, I moved back. Food and supplies. If we have special diets that we need to be aware of, how are we keeping those things? Allergies. If there's a special plate or cup or utensil that has to be used so that we can eat, we want to make sure we have those. And then food for any type of service pets also. Transportation, our specialized vehicles, do we need wheelchairs, stair chairs, slides, etc. So those are the 4 things that I'm always going to come back to with everything. And please ask questions as we go and interrupt with commentary, because it's good that we all learn. So the first thing we'll start with is snow. So here we go right into those 4 words. We want to be alert to the weather. I think it's even more important for our families to know kind of what to expect, because we have to plan ahead, and it's just kind of the way the cookie crumbles. So medication. If the snow falls and we can't get out, do we have enough medication to get through until we can get back out again? And that, I know, is a process, because if you only get a certain amount and it's only renewed here and there, you really have to work with those providers and insurance to get extra medication for a snowstorm, but something to think about before we have it. Right into the power supply. Do you have a backup generator? Do you have batteries? What happens if the heat goes out in your house? Do you have a bunch of blankets? Could you set up a tent in the middle of the living room and everybody gets cozy in that tent? With needing medical equipment, having a generator is probably a really great thing to have just in case, and it gives you a little bit more security. With that, you need to make sure that generator is actually going to run when you need it. So do you have gas? Have all of the equipment parts, I'm sorry, I'm not familiar with generators, been cleaned so that it works? Food and supplies, again, do we have enough to last us for at least 7 days? Do we have all that special eating equipment? Do we have 2 or 3 even copies of that same special cup or plate? Because if the water goes out, we're not going to be wanting to wash dishes, and some kiddos might not enjoy eating off of paper plates. Transportation, if we know snow's coming, we want to look at getting our appointments moved either to before or after. We always want to make sure our house number is visible, so that if you do happen to need EMS or fire, it's very easy to spot. And then when I was practicing this over and over again, my husband said, what about your furnace vents and air intakes? So making sure those are clear too. So that's kind of snow, and then shovels. Do you have a way to shovel yourself out? Can the neighbor come over if your front door is completely snowed in? What's kind of the plan for that? Then we'll flip into summer weather with tornadoes. So here, again, those same 4 key points. But this time, now we need to think about, where's the safe place in the house? Is that accessible to everyone? And can you fit all the equipment in that space? So earlier when I mentioned like a stair chair or a slide, do you have those kind of things to either get down into the basement or wherever it is that you're going to have your safe space? Because you have to think now about more logistics. Because how are you going to run things? How's your power going to be if you're down in the basement, and that kind of issue? Again, with the medication, this is going to get so, I'm sorry, it's a repeat, but making sure that you're kind of checking that weather. Do we have enough supply? What's our backup plan for power? In the summer, it gets super hot. So how are we going to be able to keep things cool? Do we have even those little battery pack camping fans maybe to help cool off our kiddos so they're not getting overheated? How are you going to keep food and supplies? Maybe you want to have some coolers and a store of ice to help with that kind of thing. Transportation becomes a problem because roads could be blocked after a tornado. It might be harder to get through to where you need to go, and it's also harder for emergency services to get back to you. Okay, flooding. So here now we've gone downstairs. Now we want to go upstairs or to whatever higher ground you have in your house. Life vests, just because if you have multiple kiddos that you're trying to keep track of, and now there's flooding in this fast moving water, a life vest is going to be just a nice thing to have to make it a little bit easier to keep track of everyone. So I threw that in there. Medications, now we're looking at what can we put things in that's waterproof. Amazon has a lot of those waterproof bags that, the little fanny packs that you can take on vacation to the ocean, and those work pretty well. How are you going to keep your food dry? How are you going to keep medical supplies dry? How are you going to have power if everything's been washed out? So these are the things that we're thinking about. If we've had to go up on our roof, how my son, if I took him up to the roof to get out of floodwaters, I would have to put a rope around him because he would be trying to jump off of that roof right into the water. So, some of those kind of outside the box, does it look kind of strange if you've got a rope around your kid's waist? Probably, but the alternative is not great. So just those little things that you have to figure out what works for your kiddos. I know in the EMS community and EDs, we're really pushing that if you have kiddos who go missing, who have autism, we really want to look at those water sources. And now you're having this huge water source come through. So if you have little elopers, now this is even more important to have something bright on them, so that you can help find them better. Transportation, by golly, if you needed a reason to buy a boat, you could always say that just in case there's a flood, it would be crucial to have a boat as medical equipment. I don't know if it'll work, but I think it's always worth the shot to try. So that's my plug for transportation there. I threw in train derailment because a lot of us live near trains. Not everybody does, though. But we do have kind of a significant number of trains that go off the rails sometimes. So with this, they carry a lot of chemicals, and some of those chemicals are like anhydrous ammonia, which is a fertilizer. It does very nasty things to the moist parts of your body and can be picked up by the wind. So if the wind shifts, now you have to maybe evacuate. There are some chemicals that if they spill, it's better to shelter in place. So you kind of have to start thinking about, how am I going to seal my house up without letting it get too hot? Do you have little detectives who are going to try and run to this train derailment because there's a lot to see? If you're close enough to the tracks, people are going to be coming to your house asking for help and then potentially bringing germs with them. And again, we're going back to the medication, more so to go big. So we'll talk about go bigs a little bit further down here, but just kind of getting, hey, if we have to get out fast, what do we need in that bag? And so medication is going to be huge to that. And then any of your medical equipment that requires batteries, do you have a spare one that you can put in that to go big too? But I'm getting ahead of myself. Does anybody want to talk about more about anhydrous ammonia? Yes, no? Okay. I'm trying not to get too far into the weeds on things for us, but so power outages, the biggest question that would be in my house is, how is the ice cream divided? If you have medication that really needs to be refrigerated or special food that needs to be in the fridge, now what? So here again, looking at coolers with ice, backup power generators, making sure that you have those special eating things for kiddos who are struggling with that. Transportation in a power outage isn't as much of a concern unless, of course, you have a garage door that now, how do you get the garage door open to get out? I had the garage door fail on me a few years ago, and I was stranded because I didn't have enough strength to lift the garage door up. So that would be something to think about too. How do you physically get out of your space if the garage door doesn't work? A lot of times, if there's power outages, the hospitals all have backup generators. So that's always an option. If you're absolutely without power and you need some way to supply that medical equipment, you could always go to a hospital and explain the situation to them and see if you could just sit somewhere in there. There's downsides to that too, but it is an option. Public buildings, this is another thing where you want to look at maybe, do you have shelters in the area? Do they have the power needs that you're going to have? Fire. Oh boy. So this becomes a little difficult if we have people who aren't able to move on their own. So practicing those fire drills is going to look a little bit different. And the big thing here is assigning one person, you're getting this child, you're getting this child, you're grabbing the go bag, however it's going to be, clearly defined responsibilities so that if a fire does happen, you have that plan and you know exactly who's getting who so everybody can get out. And then a meeting spot that's accessible to everyone. Where's that going to be? You want to make sure that you're not by the house. You don't want to be by the road. You don't want to be by water. You want to be in a safe space. So if a kiddo makes it there before you do, you're not as stressed. You're stressed because it's a fire, but adding a little bit less to that load. If you use home oxygen, oxygen itself does not equal fire. It's a component of making a fire, though. So oxygen tanks can become an issue. I am not the expert on home oxygen tanks, but there are lots of fire people out there who are, and firefighters are usually pretty well liked by kiddos, so this might be a nice time to invite a nice fire person over and have them kind of walk you through some suggestions, and then they get a chance to meet your kiddos when it's not an emergency, so that's nice too. There's not much we can do for power supply and the 4 keys on this one because usually there's no warning that you're going to be in a fire. This is where it's kind of nice to maybe have a little extra stuff somewhere else outside the house so that you can still have access to things. Medication, you could go into an ER and say you're out of medication and can you get more of that because there was a fire. Depending on the time of day, the pharmacy is either going to have access to that, depending on the size of the hospital, or you're going to be waiting for that medication to come from somewhere else. So then that becomes kind of a tricky thing too. Transportation with a fire, again, the fire department's going to be there. There's going to be options for that kind of thing. Identifying maybe a place to stay if by chance there was a fire, and then making sure that place is set up with some of those basic things that you need is also a good plan. And all of this goes back to being super prepared. There are lots of people in the state called emergency managers who have made this a profession, being prepared for anything you throw at them. And that's what we as families have to do, is be really super prepared on things. So we want to make a plan, and then we want to practice our plan, because it's one thing to say, oh, we'll do this. Well, it's better to actually go through the steps and do it. So we want to be alert to our changing weather and anything, going on kind of around us. It'd be nice to live in a bubble sometimes, but we need to be aware. It'd be better to hear about a train derailment that's 10 miles from your house right when it happens, other than, as opposed to, oh, somebody's knocking on the door because we need to evacuate right now. So being alert to weather, things going on around us. The go bag. I think Family Voices has done a wonderful job of getting these kind of things, suggestions for them, and the emergency, and the EFI forms, and those things, the binder. Wonderful, wonderful. Those are all things that should go in the go bag. So in that go bag, you want food, water, any special diet items. You want medications, because we're going to be prepared for anything. We want flashlights, blankets, cell phone chargers, because it's always a problem when you have zero battery left and you're trying to get a hold of people. A change of clothes, diapers, any incontinence things that you might need, food supplies, a leash for that animal. They say emergency broadcast radio, but if you have a cell phone, you have that covered. Clearly assigning duties is a big thing again. I think I've said that before. And then I put this link in there because the next slide I just literally pulled from this link. It's from the American Academy of Pediatrics, and this is their Family Disaster Planning and Supplies web page. And it goes over just, and this is kind of tiny, I'm sorry, really nicely what you should have. So big thing is that emergency information form. That's such a beautiful thing. Multiple copies of it. If you can put a copy on your phone, if you can put one in your car, just paper the place, because it really actually is handy for lots and lots of people when we get into this. We also kind of thinking about writing down your talking points about what your kiddo needs for first responders. Not everyone who is in emergency medical services knows about every disability or additional healthcare need. I have been in the ER for 20 years, and it wasn't until a few years ago that I learned about all the metabolic disorders that are out there. So having those kind of talking points and expecting to have to say them is a super duper thing, because you have lived this and you know more about this than EMS or the ED will. If your kiddo will wear, if a medical alert bracelet, that's great. Some kids are not going to do that. So if you can find somewhere to stick it on something they have with them all the time, like wheelchair, backpack, a wallet, talks about specialized transportation. This comes to that shelter issue. So if there was a disaster in your area, which shelter are you going to? And does that shelter have things like power supply that you can easily use? Does it have a little privacy so that you can do cares for your kiddo? That's something to kind of think about too, just planning ahead. It's all planning ahead. You want to have the phone number or an app of one of the disability services, like Family Voices, for example, would be a good one, just to help you kind of keep up with all that information. And then also you have access to some advocacy, which can be important. We're going to pay attention to alerts. I've said that already. The disaster preparedness kit. So here again, it just goes over that power supply, special formula, incontinence products, toys, the stuffed animal or blanket or fidget that you just cannot live without. We need that with anything for the vent, anything. I've experienced a lot of times like a Mickey button will come out, and then we at the hospital don't have that size and we have to get it from somebody else. So if you have at least an extra one, that's helpful. Communication cards or devices. If your kiddo mostly uses an iPad to communicate, then you want to make sure that's with. The AAP, of course, wants you to talk to your child's pediatrician, which are specialists, and then make sure everybody is working together to make sure those needs are met. I like to throw in meeting your EMS service and fire department before you have an emergency. If you can arrange a visit down to the local ambulance barn when your kiddo's feeling good and at their baseline, that's the perfect time to go, because it's going to give you an opportunity to explain your kiddo's medical condition. It's going to give EMS an opportunity to ask questions about it, and they're going to get to see your kiddo at the baseline. Because EMS works off of a set of what's considered, normal standard pediatric vitals. So if your kiddo, for example, has their oxygen is always at 92%, well, an EMS provider is going to see that and go, oh my gosh, we need to get this kid more oxygen. No, this is baseline. So it's important for you to kind of, show people baseline before we're in an emergency. And then also, if you have equipment that, is very specialized, this is a good time too. You can invite them over to the house and kind of walk them through how equipment works too. And I don't mean to be, what's the word? I'm not trying to be rude in saying that EMS doesn't know how to work equipment. They do. But when we get into some of these specialized things, you just don't see them as often. As families, we get to live with things every day, but EMS is not always in your house working with those things. So a nice thing for them to see too, some of our smaller services are not going to have all of the equipment that you have at home. If your kiddo is ventilator dependent and that vent has something happen to it and it's a smaller place, chances are your child is going to have to be manually bagged, which is that bag that you always see and they squeeze oxygen into, because they just don't have a vent to transport. But the big takeaway here is meeting EMS on a good day when we're at baseline. EMS gets to learn some things. They kind of know better how to prepare then if they get called to your address or if they see your kiddo out and about, and that makes it a little bit smoother if you need to do an emergency. So before I transfer into emergency department stuff, do we want to talk about any disaster things? Does Doneen have really good points to add that I've missed? Or
The only thing I was going to add is I don't know if everybody's got an emergency medical form. We do have that on our website. It's under publications. So I'll try to find it before we leave. And I would also put that emergency medical form even in the freezer. So when the ambulance may show up, at least then you know where it's at all the time. Put it in a Ziploc bag or something and throw it in the freezer. And if you should have somebody have to come to your house, it's right there and readily available. But that's all, Chetty.
all right, let's talk about the ER. So here, please feel free to cut me off if I get too into the weeds on this, because there's just a lot of information and I'd like to just go on and on about it. But I think the big question that always gets asked is, do we really need to go to the emergency department? If you think your child needs to be seen and you're very concerned about them, yes. It's literally that simple. If you're concerned about your child, take them in. I have seen, I don't know how many 3 a.m. earaches. I have had parents bring in kiddos who literally just needed a band aid put on. But I tell you what, I so much prefer that to not having them come in. Um, the ER is open 24/7 and it's there for an emergency. And an emergency is defined by what you define it as. So if you're worried, you go in. So before we get too far in, um, none of these slides are supposed to be medical advice. And there's going to be a couple times when I'll probably mama bear and flip to the other side of the table. So I apologize for that in advance, but I am not a doctor. So I am not the expert on all emergency conditions. I can treat them from a nursing standpoint, but not from a medical standpoint. So when you go into the ER, and I apologize because if you've all had this experience before, this is going to be kind of a review, but you go in and the first person you meet says, hey, who are you bringing in? Why are you bringing them in? We call the reason that you came in the chief complaint. That's just what it's called. It doesn't mean you're complaining. It's just the chief complaint. That information then is relayed to the triage person. The triage person is going to take a look at your kiddo and go, based on our emergency severity index, which is the scale that we use. It goes 1 through 5, and this determines who gets in first. ER is not first come, first serve basis. It's based on medical necessity. So if the triage nurse thinks, oh gosh, this is an immediate need, you're triaged as a 1. So this is like a cardiac arrest, respiratory arrest, flaccid infant would all be a 1. A 2 is going to be a stroke that's awake and talking kind of thing. It's also going to include pediatric fevers that you can kind of see down here. We consider fevers when they're 1 to 3 months old. That makes them a level 2 because we want to see them sooner rather than later. From there, you go 3, 4, 5. Threes are going to be like abdominal pain, kidney stones, that kind of thing. A 4 would be a sprained ankle, and then a 5 would be a medication refill. So right off the bat, you're kind of being triaged into what category you need. Even though you can't see the nurse, we have cameras in the bigger ERs that show the patients right as they come up. So you kind of get a little like, oh, this person needs to come back, or oh, they're okay to wait a little bit. So then they bring you back to the triage room, and they're going to ask, what brings you in today? If your kiddo's a teenager, we do try to let them answer their own questions if that's appropriate, just to give them a little bit more control over a situation that feels a little out of control. But we're also very used to the caregivers answering for them. We want to know the history of the complaint. We want to know your child's baseline. Like, why are you concerned about this? What is off from their usual? Up to date on their immunizations. And I don't mean this as a hot topic. It just goes back to that slide I just showed you about the fevers. So immunization time and fevers, that's why I'm worried about that. We, of course, want to know allergies and medications. And then we want to weigh that kiddo in kilograms. At the bottom, I just put what we teach for nurses and EMS is to do a sample. So that's basically what we just did up there. Those are the things that we always want to look at when we have a kiddo coming in. We're going to spend just a moment here, though, on weight in kilograms because all of our medication doses for PEDS patients are based on kilograms. So if a nurse or a healthcare provider is saying, oh, this kid is 22 pounds, and then they put that in the chart, and then we have to do medication, and now we're basing it off of 22 pounds instead of kilograms, we've essentially more than doubled the dose of medication. So one of the things EMSC did was offer all the hospital EDs free scales that weigh only in kilograms. And with those scales, everybody got copies of this little paper here. And the intent is that the nurse, the triage person would take your child's weight in kilograms. They would tell you the weight in kilograms, and then you can look it up yourself, because the idea is we don't want anybody ever saying weight in pounds. We want to keep it all kilograms. So that's what this chart's about. So if you go to a doctor's visit or into the ED, make sure what is their weight in kilograms. It's definitely okay to ask them that and kind of remind them to do it. So once we get past triage, you're either going to be sent back out to the waiting room to wait, or you're going to be brought back to a room. So you're going to end up in one of two rooms usually. And the top room, and I apologize, it's blurry, is kind of a standard ER room. This one is bougier because it has two chairs in it. You don't see that a whole lot. So you get a stretcher with a sheet on top of it, a pillow kind of up here in the corner. You can see some equipment. It's going to be your vitals machine. That's where we can keep track of blood pressure, heart rate, oxygen saturation. We're going to put them on oxygen on our supply if they need it. And this is where you're kind of going to wait for that primary nurse and medical provider to come in and do an assessment and stuff. These rooms get small really fast. If you have a wheelchair, this gets even tighter. But luckily, these beds can move, so we can shove those over into the corner. If your kiddo is more comfortable in the wheelchair, you just need to say that. Once we have that important weight piece, we want to keep everybody as comfortable as possible until it becomes medically necessary to do something else with them. And then we hook them up to take vitals back here just to kind of watch. Usually we're always watching our oxygen saturation, because with kiddos, respiratory distress is our big thing. We want to prevent that from progressing any farther. So that's that room. So we're waiting in here for the provider to come. The other room that you could end up in, this is more like a trauma room, or what we call a resuscitation room. This has kind of bare bones. There's a lot more equipment in here. This is where you're headed if you need a lot of intervention. If your kiddo needs to have a breathing tube put in, you're going to end up in a room like this. Some of those more bigger events are going to be in here. Now, caveat to this, though, is if it's the only room in the ER, you might just end up in there because it's a bed. But those are the two rooms we're going to be looking at. And then your primary nurse is going to come in, and they're going to ask you all of the same questions as what you just went over in triage. And you're going to wonder, why aren't people looking at the computer? And usually we aren't at that moment, because chances are that nurse has come from another room straight into yours. Make sure they wash their hands. It's definitely okay to say, hey, did you wash your hands? That's okay. You can remind them. So then we look at the computer once we've kind of talked to you, and then we have a better idea of what's going on. Then your provider is going to come in, depending on the size of the ED. You're either going to have a nurse practitioner, a physician's assistant, an MD or a DO, and they are going to ask you all the same questions that you've already gone over twice. But it never fails that the provider always gets a little bit more information than the nurses did. And it's a source of conflict. But anyway, here, it's a good thing to have. So we're going to be advocating pretty much our entire ED visit, because, and there are lots of studies out there that show some implicit bias towards people who have additional special healthcare needs. So I'm not telling you to put on, like, I, I'm not trying to set the stage for confrontational, but I am saying that you're going to have to put on a little bit of your armor to go in, because not there's different levels of compassion and understanding in every medical provider area. And ED tends to attract people who are wanting to get people in and out. They're adrenaline junkies, and we want to rush in and rush out, and names are optional kind of thing. And sometimes that doesn't work when our kiddos need a little bit gentler, slower approach. So, right off the bat, we know we're going to have to do some advocating. So, we want to have a copy of our EFI with, because that's going to help the nurse a lot and the doctor, because we'll be able to look at it and go, oh, yeah, sure enough. Yes, yes. If you have treatment directions from a specialist with, this is super exciting. I had a patient who came with a laminated copy of what to do if they were dehydrated one time. And it was just amazing because it was all laid out. It had the phone number for the specialist. I gave it to the physician. They just ordered what was on there, and it worked very, very well. So if you have stuff like that, that's awesome. Um, or if you have a phone number of the specialist you want us to call, also great. If it's after hours, of course, this becomes tricky sometimes to get a hold of people, but the physicians will definitely try to do that. And then taking notes. I know a lot of people video record in the ED. That's getting more and more locked down just because of HIPAA, and you don't want to invade somebody else's privacy, but you can always take notes on what is being done, and you should ask questions. When your child is receiving medication, you should be told what they're going to give that child. If they don't tell you what they're doing, ask. If you find that you are just not meshing well with this nurse and things are not going well, then you need to say, I'd like to speak to your charge nurse. When that charge nurse comes in, say, I would like a different nurse for my child. And that's very, very acceptable and happens sometimes. And you should feel that you can do that. You don't have to be stuck in the ER, stressed out already, and then have a nurse that you're just not dealing well with. I've had patients also ask for different doctors. That takes a little bit more, and is not always an option if you're in a smaller ED where there's only one provider on. But you can ask for different medical providers. That's very much something you can do. So we went over that. And then I wanted to kind of touch on charting. So I have been alerted to, through this job, families who have struggled and been painted into some issues with Child Protective Services because of their child's medical condition. And then the charting that's been done by medical providers hasn't helped. An example that I can think of right off the top of my head was kiddo was in for an illness, and both mom and dad were there. And dad was kind of sitting, by bedside. Mom was also there, but mom would have to leave because there were other kiddos and things to do. And it got charted as mother repeatedly leaving bedside. Well, no, that's not the whole story. This kid was not left alone in the ED. They had another parent there, but that wasn't put in the charting. Or, some medical conditions, you're going to have more bruising. More bruising is going to raise some flags because that's what we're trained on. But when it's a medical condition, we need to make sure that we're getting that in the chart. So with the charts all being online, you can look at that chart. And if you find something that is a completely inaccurate description of how that visit went, You talk to medical records and you ask them to amend the chart. Um, if you had poor treatment and it was a disaster of a stay, you can file a complaint with the hospital. They have people there who do all those patient complaints. You can, if your kiddo's receiving like Medicaid, you could file a complaint with Medicaid, or you can also file a complaint with the Joint Commission. The Joint Commission is the hospital healthcare accreditor who comes through and says, oh, yes, this hospital is good patient safety, and yes, they take good care of people. It's a nonprofit, but hospitals, usually pay to have them come in and evaluate them so that they can be Joint Commission approved. And when they have patient complaints because people were treated unfairly, that's going to reflect in their scores. So working with the people in the ER is obviously the way you want to go. I don't know how to say this, but I guess just also be prepared to get a little of that mama bear out and know that you're advocating for your child, and at the end of the day, that's all that matters. And they can do better. Um, I have been frustrated with my colleagues over some of the way they treat kiddos with the autism because they don't understand. Um, it's a sticking point for me. So part of EMSC has been getting them education that comes with Carter kits to these smaller hospitals, because I want them to start understanding that this is not just a kid who's having a meltdown, or this is not, I want a better picture out there. It's going to take some learning. I'm trying to focus some more on these kiddos with some special health care conditions because I don't want them to be lost in the shuffle. And I know that we can do better and we should be doing better, is what I will say about that. And then, since Amy is on here, I'm going to go ahead and also mention that, are you guys aware of Rapid SOS? It is a service that when you open your brand new Android or iPhone or whatever it is, and you scroll down and you accept those terms and conditions, you're accepting this service. And basically, what Rapid SOS is a way to communicate with 911 and also gives information to those dispatchers. So it's kind of like how your Apple Watches work. If you fall down because you're out jogging somewhere and knock your noggin, Rapid SOS is that technology that's going to help EMS get to you. So if you go into your health app, you can fill in all sorts of information about your kiddos. You can say, if we're in a car crash and we're driving, this is our license plate. Please be aware that my child needs to be fed every 2 hours. That information then goes to the dispatch centers and they can share that with EMS. And it's a completely free service, and you've already agreed to it. So it's another tool to have when we're talking about disasters. And Amy, do you mind if I put you on the spot, or you want to tell them more about it, or?
No, I tell everybody about it because if you have a cell,
Oh, you cut out, Amy. She froze.
Oh, it it also works on like tablets, anything that you have connected to Wi-Fi,
phone,
maybe. She'll interrupt me if we, yeah. So
you've
it works.
agreed to have this app on your phone, and whether you choose to put information in on it or not,
Is entirely up to you. Um, you get to decide what you share and what you don't share. It's has applications for people who might be in a domestic situation, because you could put in, if you get a call from this number but nobody is saying anything, please send help to XYZ. But the big thing is for us was, oh gosh, here's a way to say, you know, my kiddo has autism. He may run away if we're in an accident. So please be aware of that. Um, so rapid SOS is another thing out there. That kind of questions, and I saw stuff in the chat, but I just couldn't multitask well.
It was
So,
stuff I put in there,
oh,
Chetty.
okay,
Yeah,
good, good.
yeah.
And I'm sorry, I guess this isn't a full hour. Oh, pretty close though. But
Pretty
um,
close.
is there anything I can answer? Are there any horror stories you want to tell me just to get them off your chest? Do you want me to make some notes of nurses I need to talk to around the state? Or like, how can I help you?
Chetty, I'm gonna shut the recording off, so that, if it's any sensitive information, it won't be on the recording, okay?